begin with our big focus and our big story. We've been consistently telling you how the situation is panning as cases spike in India. We've been the first to report on the shortage of beds in major cities and what's happening in Mumbai and Maharashtra. We were the first to tell you that remdesivir stocks are running short and the prices have been capped now in Maharashtra. There has been a meeting with all the manufacturers to say that they must double production. We were also among the first to tell you that vaccine shortages are beginning to happen. Today we broke the story that 26 centers in Mumbai had to shut down their vaccination program because they simply ran out of stocks. It's of little doubt that vaccines are running thin. State after state is reporting this. Among others, Maharashtra, of course, Odisha, Chhattisgarh, Delhi, all of them have reached out and said that, hey, we need more vaccines. Unfortunately, it's devolved into a center versus state fight, with the central government now saying that these arguments are baseless, that enough vaccinations are given, and it is the states, in fact, which are wasting their vaccines. The moot point remains that if we want to enlarge the number of people we vaccinate, even those above 45, and to expand it to below 45, we will have to wait for a bit because those capacities in India currently just simply do not exist to vaccinate at the pace we are right now. That's just a simple fact. This is something that the Prime Minister alluded to in his address today at the Prime Minister's Chief Minister's meeting. They were all meeting to discuss the ongoing COVID-19 situation. So he spoke about how capacities can't be built overnight and the focus should be on testing.
निश्चित तौर पर इसमें टेस्टिंग और ट्रैकिंग की बहुत बड़ी भूमिका है। हम टेस्टिंग को लाइट न लें। टेस्टिंग को हमें हर राज्य में इतना बढ़ाना होगा कि पॉजिटिव रेट कैसे भी करके 5% के नीचे ला करके रख जाए। और आपको याद होगा, शुरू में जब कोरोना की खबरें आने लगी तो हमारे यहाँ कंपटीशन होने लगी। वो राज्य तो निकम्मा है, वहाँ बहुत बढ़ गया, फलाना राज्य बहुत अच्छा कर रहा है। राज्यों की आलोचना करना बड़ा फैशन हो गई थी। तो पहली मीटिंग में मैंने आप सबसे कहा था कि संख्या बढ़ने से आप जरा भी चिंता मत कीजिए। उसके कारण आपका परफॉर्मेंस बुरा है, प्रेशर में मत रहिए, आप टेस्टिंग पर बल दीजिए। और वो बात मैं आज भी कह रहा हूँ, संख्या ज़्यादा है इसलिए आप गलत कर रहे हैं, ये सोचने की जरूरत नहीं है। आप टेस्टिंग ज़्यादा करते हैं, उसके कारण पॉजिटिव केस नजर आते हैं, लेकिन बाहर निकलने का रास्ता वही है। और जो आलोचना करने वाले हैं, थोड़े दिन आलोचना सुननी पड़ेगी, लेकिन रास्ता तो टेस्टिंग का ही है। टेस्टिंग के कारण आंकड़ा बड़ा आ जाता है, आने दीजिए। मेरा आप सभी से आग्रह होगा कि हाई फोकस्ड डिस्ट्रिक्शन जो है, उनमें 45 साल के ऊपर 100% वैक्सीन के लिए लगातार प्रयास कीजिए। एक बार एक तो अचीव करके देखिए। मैं एक सुझाव देता हूं, क्योंकि ये कभी कभी वातावरण बदलने के लिए चीजें बहुत काम आती हैं। 11 अप्रैल ज्योतिबा फुले जी की जन्म जयंती है और 14 अप्रैल बाबा साहब आंबेडकर जी की जन्म जयंती है। क्या हम 11 अप्रैल से 14 अप्रैल पूरे अपने राज्य में टीका उत्सव मना सकते हैं? एक पूरा वातावरण क्रिएट कर सकते हैं टीका उत्सव का। एक विशेष अभियान चलाकर हम ज्यादा से ज्यादा एलिजिबल लोगों को वैक्सीनेट करें। जीरो वेस्टेज तय करें हम कि इन 4 दिन जो है टीका उत्सव में जीरो वेस्टेज होगा। वो भी हमारी वैक्सीनेशन कैपेसिटी को बढ़ा देगा। हमारी वैक्सीनेशन कैपेसिटी का ऑप्टिमम यूटिलाइजेशन ये हम लोग करें।
All right, let me welcome Dr. N.K. Arora, who is the co-chair of India's National Technical Advisory Group on Immunization, Dr. Giridhar R Babu, who is the head of Lifecourse Epidemiology at PHFI, and Anant Bhan, Global Health and Policy Expert. Welcome to all of you and thank you for speaking with us today. Dr. Arora, let me come straight to the point of vaccines. While it is a really sad state of affairs that this has become a blame game, that you wasted vaccines, we gave enough, no, we don't have enough vaccines. What is the factual position? Do we have enough vaccines to sustain even the above 45 category at the rate which we are?
So, if you remember, the initial prioritization list was up to 50 years. And above 50 years, we have 26 crore people. And another 3 to 4 crore was various frontline workers, including medical personnel and others. So that made 30. And that was about 22 or 23%. Extending the age by 5 years has added around 8 to 10 crores more. So now we are targeting 30% of the population. So when we were talking about 50 years and above, the total requirement was around 600 million and another 10%, so around 660. And the government has that commitment from the manufacturers that by July, August, they are ready to provide that many doses. And that matched with the production capacity also. Having said that, now with expanded age group, 40 crores, we need around 900 million or 90 crore doses, which takes into account 10% wastage. But unfortunately, ever since we have started, our capacity of the immunization centers is utilized only about 30 to 45% maximum in various states. Because each center is able to immunize about 200 people per day, 150 to 200. So if today we have 50,000 centers, we should be able to immunize about 8 to 9 or 10 million, or anywhere between 7 to 10 million people. But we are hovering around 3 or 4. I mean, 4 we have just touched yesterday or so, but mostly it was between 2 and 3. So the capacity utilization is clearly not there, our full capacity of immunizing. And it is so important that our population, which is above 45 years, must use it, because that is the main purpose of immunization at this time. That is reducing the severe illness and fatalities. Because this vaccine does not interrupt the transmission of virus. So even if a young man who normally gets asymptomatic or mild symptomatic disease, if he or she gets the infection will occur and it will be transmitted. And this we have seen recently a lot of reports where in KGMU, Lucknow and other places, a lot of people after vaccination have got infected. They are assured of not a severe illness, but this just goes on to show that anybody who has vaccine can get the infection, but it will be a mild infection. Therefore, keeping all these in mind, country has about 650 million doses as of July, sufficient supply. That's what I've given to understand. I do not understand the further nitty-gritties, which is more like an operational issue, and maybe somebody from the ministry or the state health departments can answer to that.
No, so today what the health minister has put out is that we have 42 million doses, including some which are in the pipeline. If you just look at current number of doses, is 24 million or odd or so. The health ministry itself has put out figures yesterday that we are vaccinating a little over 3 million a day. So as of today, including what's in the pipeline, the fact is we have about 10 odd days of dosage, Dr. Arora. I'm not talking about what will come in July. I'm talking about what we have right now as per what has been put out by the government.
So what it means is that there is all 600 million doses are not available today. This is to be linked with the production capacity. And the way I think a pipeline has been built, which I understand, is that the country will regularly have, and it should have access to around 650 million doses till July, which is a huge amount, 60 crore doses. And at the moment, we have just used 90 million or 9 crore doses only. So as far as availability, as I understand, there shouldn't be any insufficiency of vaccine for the country, and there is even the export has been suspended for a while. So even COVAX commitment country had, and the other exports, they've all been suspended, as we understand, for last 3-4 weeks.
You know, interesting aside to this, reports today that AstraZeneca globally is suing Serum Institute of India because they're not fulfilling their commitment to it, which was to supply doses, and they can't. Dr. Babu, I just want to understand from you your perspective on this increase in capacity that we're expecting by July, as Dr. Arora is describing it. Now, Serum Institute of India has on record said it has about 65 to 70 million doses capacity per month. What is publicly available on Bharat Biotech is 4 to 5 million doses of capacity. At the upper end, it is 75 million doses per month. Obviously, we're utilizing much more than that. At the current rate, we are 90 to 95 million doses per month. How will this capacity increase to such a large extent in the next 2 or 3 months? Is that even feasible?
Yeah, thanks for having me on the show. I think there is a supply constraint which we can see, although there is availability of vaccines in the pipeline from the 2 permitted manufacturers within the country. I think as Dr. Arora sir has explained, even in this panel and also earlier, there is a move to allow more vaccines in the future, at least 2 in the next 1 or 2 months, and then probably more later. I think those entries of the other vaccines should take off some of the stress on the supply constraint. At the same time, what we also need is smart use of vaccination in the field. Currently, what's happening is there is a sort of disequilibrium in terms of some centers having the capacity to do more and some where the wastage is more. This has to be reduced by ensuring that there is better micro-planning, which links required number of beneficiaries to the particular site, vaccination site, and also mobilization efforts are done to make sure that people come to the vaccination site on time and there is least vaccine wastage. By combining both micro-planning and mobilization, I think we have done this for other vaccination campaigns. We can also deliver this time, but there will be some stress, especially when the cases are surging. There is also a feeling that people think by vaccinating more, somehow magically the rising cases will disappear. And because there are no other alternatives, people think vaccination, at least all the age groups, will somehow make them get a bigger relief, which may be a reason why there is a lot of discussion on why we can't have more vaccines immediately. Right now, as the Honorable Prime Minister today addressed in his, I think this was brilliant today when he said, right now we need to ensure that the total burden of the disease comes down. Containment should be the focus. That can be done only by testing. The most important thing today, what I saw is finding more and more cases is the best way to contain as early as possible. It is the silent areas which are more dangerous because they are not testing well, they're not in the transmission.
Dr. Babu, I just want to get some clarity on what you said. You said there is this belief for some reason that if you vaccinate, more infections will come down. And that's interesting because ahead on the show, I will be speaking with Dr. Jayalal, the National President of the Indian Medical Association, which has written to the government this week saying, please vaccinate everyone above 18 years. But Dr. Babu, isn't the data we're seeing coming out of the UK and Israel that have vaccinated a fair bit of their population, proving the fact that more vaccinations include lowering of transmission rates? We are seeing it from what their experience has been.
Yeah, let me explain. The efficacy of the vaccine is tested against preventing deaths, and preventing severe illness. Currently, our priority is to ensure that we prevent deaths and prevent the severity of illness among the vulnerable. It is definitely aspirational to ensure that every adult can get the vaccination. As I said, aspirational does not mean that is an immediate priority, but the immediate priority is to prevent deaths. Since the efficacy is proved by preventing deaths and preventing severe illness, the many confusions arise because people think that by taking vaccine they can't get an infection, they can't get tested positive, which are all not actually true. They can still harbor the virus, they can still transmit the virus. So therefore, they need to continue wearing masks. That's the message given by the vaccine manufacturers also. That this protection comes only after 2 doses, especially 2 weeks after the 2 doses. So in order to have maximal impact, we need to be covering 2 doses to the entire population. We can't wait for this long without containment measures. Right now, the priority is to ensure that we have, and also, Tamanna, it's very important, higher the circulation, the virus keeps replicating more, higher is the chances of errors, and errors lead to mutations. Mutations lead to at least some of them becoming more infectious or even immune escape variant. So currently the focus should definitely be containment, ensuring that the areas of transmissions are limited, and expand the vaccination, definitely at a faster pace. I'm one of those who advocate that, as Arora sir rightly said, at least 7 to 10 million doses we ought to cover. We have the capacity, we have the potential to do that. But at the same time, currently the focus is to ensure that the trajectory of the cases, which is going probably towards exponential a little later, we need to curb it right now.
Yeah, so the 7 to 10 million doses per day capacity right now is not there. Anant Bhan, I think there are a couple of questions that we must address. For one, did we lose time in making sure we have more capacity for vaccinations? It is no secret what the population of this country is. It is no secret that 60 to 70% coverage of vaccinations will be required to achieve herd immunity. So why don't we have, why aren't we close enough to that target of capacity so far? Because by this time, the calculation was that you would have more vaccine candidates and you would have more manufacturing capabilities.
Sure. Thanks, Tamanna, for having me as well. Yes, absolutely. That could be a good question to ask, but I think, we have to realize that a lot of our production facilities are essentially private entities, and private entities will depend on estimates around what is the demand for them to decide how much production to generate for any particular vaccine. Now, that demand comes from two sources, domestic and international, and I think that's what the companies are primarily dependent on in terms of increasing or enhancing their manufacturing capacity. Now, certainly Serum has known for a fair bit of time because they had the license from AstraZeneca, and there's been a lot of global interest after WHO pre-qualification in getting that vaccine supplied, and so from COVAX, from individual country orders, as well as from domestic orders. But it's always going to be a challenge for any singular company or even two companies to be able to supply enough vaccine for a country of our size. And that's where I think more vaccines being licensed for use under the restrict emergency use authorization mechanism might certainly help, as Giri was alluding to. But that also requires those vaccines to go through some minimum testing, minimum standards of figuring out safety and efficacy. We cannot skip those steps. We've had that discussion last year. We all realized that you need to ensure that we have adequate data on that to be able to make that decision. So till that data comes through, we cannot be, jumping the gun on those. But hopefully that data will come through soon, and we will have more vaccines available, and that should help with addressing some of the concerns around the shortage of vaccines. That having been said, I totally agree with Giri and Professor Arora that we need to ramp up our vaccination efforts. We also need to do it smartly. Even just today, I've heard of incidents where at least there are pockets within the country where clearly not enough vaccines are being used. There is a concern around wastage. There is already efforts being made at health centers to go out and try to reach to those who are above 45 because they're not having enough people turn up in centers or facilities.
Yeah, but I mean, No, Anand, let me come in here. Let me come in here. I'm sure there are pockets where there is still vaccine hesitancy and there is wastage. Wastage of a certain percentage, as I understand it, and as Dr. Arora also mentioned, is inbuilt in your calculation of doses that you will require. But there is also a clear situation where there are people who have been turned back today, eligible people, because there are no vaccines. We can't turn our eyes or avert our eyes from those facts, can we?
No, we should not. And I think that is a learning curve, certainly for the health system. If you have a lot of demand and you're not able to supply it on those particular days where there is that demand, that should certainly be cause for concern. But that should also be quickly be factored into how you respond. So if there is a demand, you need to ensure that there is supply diverted, especially if those are individuals who are eligible. But then this is also seemingly happening in pockets, not everywhere. And that means that you could perhaps be doing some smart reallotment and try to figure out where that additional demand is coming from. So if people are refused the first day, it should not be the case that that refusal continues for the next 20 days, 25 days. There should be a way of being able to call them back and say there are vaccines available now. We have realized that there is more demand here, and be able to address that demand. I mean, what you don't want is this kind of situation to be ramped up everywhere across the country and cause a lot of breakdown of trust in the vaccination efforts. We need more and more trust built in, and it's great to see more demand. Because part of our concern early in the vaccination efforts was there was not enough demand.
Utsav, of a vaccine, I think an idea of a Tika Utsav or a vaccine festival is superb from 11th to 14th April as has been proposed by the Prime Minister. But then we have to ensure that the vaccines are also there. And we can't deny the fact that today at least 5 states have come out and said we have stocks for just a couple of days. If more stocks can come before these run out, that is great. We have to see what the statistics say and make our plan accordingly instead of turning this into a finger-pointing blame game. I want to thank all of you for joining us in the first big story this evening.